Hi there, welcome back to the channel. Today we're going to talk about a question that I get all the time and that I've been seeing in a lot of pregnancy forums too, and that is, how much weight should I gain with the pregnancy? Once upon a time, when I was a resident, the weight gain recommendations were the same for everybody. We said you should gain 25 to 35 pounds if you're carrying a singleton baby, and something like 25 to 35 pounds if you're carrying twins, period. Fortunately, today our recommendations for weight gain are tailored to the individual person. Usually we start with your body mass index, or BMI, and we look at that not when you're 28 weeks pregnant, but before becoming pregnant or in the very early weeks of pregnancy. So let's talk about how to calculate your BMI. To start, you take your weight in kilograms. You're going to divide this by your height in centimeters squared. Or if you don't want to make this calculation yourself, get online. There are any number of BMI calculators online where you just plug these numbers in and it spits out your BMI. Your BMI in pregnancy is obviously going to change because your weight is going to change. So we base our weight gain recommendations on what your BMI is or was either just prior to pregnancy or in the first couple of months of pregnancy. And if you have a normal BMI, and normal is about 18 to 19 up until about 25. That is the normal weight range. Under that and you're underweight, and over that and you have either overweight or obesity. So usually between 25 and 30 is considered overweight, between 30 and 40 is considered obesity, and over 40 is morbid obesity or super obesity. BMI is not always the most accurate assessment of your health or even an accurate assessment of obesity, especially if you have a pretty high muscle mass. So Ilona Maher, the rugby player, has done a great job of teaching us this. Her BMI is over 40 and she's one of the most fit and healthy people around. So don't place too much importance on your BMI. It's just a number that we use as a starting point to help calculate what your weight gain should be over the course of the pregnancy. All right, so let's talk through these numbers. If your BMI is less than 18, then you should gain a little bit more weight. You've got a little bit more latitude to do this. We recommend that you gain about 28 to 40 pounds. If you are in what's called the normal weight range, between 18 and a half and 25 BMI, then you should gain the standard 25 to 35 pounds during pregnancy. If you're starting out ahead of the game in the overweight category with a BMI between 25 and 30, then you should gain about 15 to 25 pounds. And if your BMI is 30 or more, then we ask you to try to limit your weight gain to 11 to 20 pounds. The important takeaway here is that no matter where you're starting from, even if your BMI is 40 or 50, you should not try to lose weight in pregnancy. If your BMI is in the obese range, over 30 or over 40, then it would be okay to make a plan with your physician to minimize your weight gain to 11 to 20 pounds or even closer to 10 pounds, but don't try to lose weight in pregnancy. Next, let's talk about what should happen if you're carrying twins. If you're carrying twins and your BMI is less than 18.5, then you should gain probably 50 to 60 pounds over the course of the pregnancy, which sounds outrageous, I know. If you're in the normal weight range between 18 and a half and 25 BMI, we shoot for a weight gain of 37 to 54 pounds. If you're in the overweight category with a BMI of 25 to 30, then we request that you gain about 31 to 50 pounds. And if you're in the obese range, if your BMI is over 30, we usually ask you to limit weight gain with twin pregnancies to 25 to 42 pounds. So where do these numbers come from, you may wonder? And the fact is that studies have been done looking at women at different BMIs and different weights and looking at their pregnancy outcomes, the size of their babies, and complications in the newborn period. And the best outcomes tend to happen when your weight gain is in this range, depending on your weight when you're starting out. Next, let's talk about how to talk to your doctor about your weight and about how much weight gain to have. Our weights are so fraught with emotion and judgment that many times it's so hard for you to talk to your doctor about how much you weigh and how much your weight gain should be, because you're afraid that he or she is going to judge you or tell you to lose weight or not gain a lot of weight or tell you to go on some drastic calorie restricted diet. And it's hard for doctors to talk to you about weight gain too. It's kind of embarrassing all around. So what you have to do is take that first step and talk about, you know, what is my BMI today and what would you recommend for my weight gain? And then let's just talk about ways to achieve that goal. Another question I get asked is, well, if I gain 30 pounds in pregnancy, I'm not having a 30-pound baby, where is that weight going? Here's the answer. So I had to look this up too, but your boobs actually gain up to 3 pounds, which is not surprising because you feel so much heavier in pregnancy. Your uterus itself gains about 2 pounds. The placenta can weigh 1 to 2 pounds. Amniotic fluid accounts for at least several pounds of weight gain in an average weight baby. There's increased blood volume because you've got so much more blood flow circulating, and that can actually account for 3 to 4 pounds of your weight gain. There's also increased fluid volume, so all the swelling that you're having in your ankles, in your face, in your hands, that actually accounts for about 2 to 3 pounds of weight gain. And you have to increase your fat stores in order to nurse a baby, and that usually accounts for about 6 to 8 pounds of your weight gain. More of us are in the overweight to obese category, so let's give some part of this discussion to how to limit your weight gain in pregnancy to the goal of 11 to 20 pounds that we recommend for probably more than half of our patients. And the simple answer to that is to eat like we tell our diabetic patients to eat. In other words, don't focus so much on calorie restriction, but focus on what you're eating, the combinations of food, and the order that you eat your food in. So every meal and every snack should have some protein. And in general, you want to eat a gram of protein for just about every kilogram of body weight. If you're starting out at 70 kilograms, which is about 150 pounds, that's a lot of protein. That's up to 70 grams of protein that you have to get in over the course of the day. But if you start every meal and every snack with protein or fat, then that takes longer for your body to break down, and it's less likely to be stored as fat. So kind of counterintuitively, it's not eating fat and eating protein that promote weight gain. It's eating the starchy carbs that make you secrete more insulin, and that promotes fat storage and weight gain. So load up on the protein and healthy fats, fill in with carbs and grains and starchy foods at the end of every meal, and don't worry too much about your weight. In other words, don't weigh yourself every single day. Your weight will definitely fluctuate from week to week and month to month in the pregnancy. Last of all, don't forget the role of exercise in pregnancy. It doesn't necessarily help with weight loss when you're trying to lose weight after the pregnancy, but it helps control weight gain and it helps control your blood sugars. Remember that weight gain over 50 pounds in pregnancy is associated with an increased risk of a big baby and therefore an increased risk of birth injuries for babies during the birth process and low blood sugars for babies after delivery. I encourage you to bring this up and break the ice with your provider. Talk about your weight gain and talk about weight gain goals in pregnancy, because how are you going to hit that goal if you don't develop a strategy? Be upfront and honest and talk about your body as though it's a third party sitting in the room. As always, our goal is healthy mom, healthy baby, healthy pregnancy, healthy delivery, and healthy childhood for your baby. Your weight gain in pregnancy can program the baby's metabolism differently, so that if you gain more than 50 pounds in pregnancy, or if you have gestational diabetes that's not well controlled, your baby can be programmed to be at risk for childhood obesity and childhood diabetes. Not to scare you, but this really is important for your health and your baby's future health. Remember to have a clear and open line of communication with your provider so that between the two of you, you can reach this goal and have a healthy baby.